Hello and welcome to the program. I'm Teniola Shoboale. We begin our coverage of the coronavirus pandemic here in Nigeria, where some citizens who had been stranded in the United Kingdom due to lockdown restrictions have arrived in the country. Their arrival at the Murtala Mohammed International Airport follows the announcement of plans by the Nigerian High Commission in London to evacuate about 700 stranded Nigerians in batches and listed procedures to be followed in the exercise. According to the federal government, the evacuees will undertake a 14-day mandatory isolation. Just 2 days ago, 256 citizens were evacuated from the United Arab Emirates by the federal government. The World Health Organization has called for a strengthening of the healthcare systems in Africa, warning that the number of rising COVID-19 cases and deaths could overwhelm the available medical capacity in much of the continent. The WHO says an estimated 190,000 people in Africa could die of COVID-19 in the first year of the pandemic. A study released by the organization predicts that between 29 million to 44 million people could become infected in the first year of the pandemic. That's if containment measures fail. According to WHO Africa Director Matshidiso Moeti, the transmission of the virus in the continent has been slower but could result in a longer outbreak. For more on this, we're being joined on the program by public health specialist Dr. Samuel Okerinde. Thanks for joining us on Network Africa.
Thank you for having me.
So 190,000 is a startling figure. Do you think there is a viable basis to this prediction from the World Health Organization?
Okay, thank you very much. Now, the study that we just talked about was carried out in 47 African countries that had about 1 billion population, and they came up with that predictive modeling of the number of deaths. I don't think that number is surprising. Because if you look at some of the premises they had, they talked about the issue of the transmission rate, the age of the people that were involved. Particularly, they emphasized the issue of the social and the environmental factor. And when we talk about the social factor, of course, we talk about the Africa known as the low economic and medium economy, and a lot of people, it's more like the capital of poverty of the nation. So some of these factors, and when you look at the fact that also the health system has been in a state of shambles, if you look at the number of hospital beds compared to the population, also from this report, it was striking that, for example, that one ICU bed to about 1 million people. That indeed is one of the reasons why some of those figures, to me, which I still think still conservative or modest, I believe Africans can have actually more than 190,000 deaths if those things are not put in place.
Yeah, you know, the health systems in Africa can be said to be struggling. Many healthcare facilities across the continent lack basic supplies. Even before this pandemic, that has been the situation. Can the continent really overcome coronavirus without peaking? And do you think a second wave of the virus is possible here?
That's really a difficult question because you really can't talk about health system. You just don't wake up overnight and say you want to start fixing the health system. It takes a lot. For example, the health system, one of the components of the health system include financing that we have not seen. For example, in 2001, the head of state gathered in Abuja, what we call the Abuja Declaration, and they all agreed to budget at least 15% of their annual budget. That we have not seen. For example, in Nigeria, I don't even think we've even gotten up to 8 or 9% of our budget. So it's really fearful. It's not something you just wake up, for example. And part of health system is also health workforce. That we have not seen. You have like one doctor to about 4,000 or more in Nigeria, and with worse in some other African countries. So it's a really fearful situation that we have, and I really doubt it is something we can quickly, but we really do need to make some efforts, starting from budgeting and then putting another finance into the system.
Let's, look at this as a whole with the predictions from the World Health Organization that cases are likely, to spike. We're expected to see a rise in cases this year. Do you think this forecast can be tied to maybe perhaps a lack of ventilators in general healthcare that are unable to meet the number of cases?
Okay, so like we've seen, and part of the report is that we're going to have up to as high as 44 million people infected in Africa in just 1 year. And Africa, of course, has overpopulation. We have about 1.3 billion, above 1.3 billion. So the majority of people that will come down with the infection will be asymptomatic, and some will just have mild symptoms. Now, of those, according to the report, we're probably going to have about 52,000 people that would need severe case like that. We need ICU and all of those cases. So I think that the issue will be that for those that will be infected, we may have issue of the healthcare system being overwhelmed, because there may actually not be spaces to admit, particularly those who show moderate to severe symptoms. Not all those that are even severe may need ICU. But like I said, the fear will be the lack of bed space to be able to accommodate most of the people that will come down with infection. We have about 50-something million. And if you look at the number of bed spaces and the health facility in Africa, it's really in a worrisome state. And I think that so much will need to be done to really save the healthcare system.
But when you compare, the cases we're seeing in Africa to the rest of the world, how would you rate Africa's effort in curbing the spread of the coronavirus? We've only seen over 50,000 cases. How would you rate Africa's efforts so far in curbing the spread of the coronavirus? And why do you think we're seeing lower cases than the rest of the world?
Okay, so I think that we cannot begin to compare yet. There's no basis for comparison. For example, if you look at the number of tests that has been done in some of those countries, if you look at the number of tests in US, for example, they probably get into about millions. In United Kingdom, they probably plan to do about 100,000, and they say they're looking at 20,000 tests. In Nigeria, for example, we have barely done about 20,000. So we really can't compare until we begin to test more. Do a lot of more contact tracing, then I'm sure we may have more than what we have now. Until then, we'll be able to compare. But for now, I think Africa they really need to do more. I wouldn't really want to score them low, but I think they really are below pass mark for now. They need to up their game and upscale and ramp up testing.
All right, then, public health specialist Dr. Samuel Okerinde, thank you so much for speaking to us on Network Africa.
Thank you for having me.